Hi, my name's Andrea. I'm the student nurse. I was wondering if you could give me the SBAR report on your patient, please.
Absolutely. My name's Chris. I'm a nurse caring for Marta Yarn. She's an 80-year-old female. She's in room 529. She is a patient of Dr. Stephen Jolly. She has a stage 3 non-healing sacral ulcer for 3 months. She's been treated in the outpatient setting without success and was admitted by her primary care physician. She has a procedure scheduled in the morning for debridement. She has no known allergies. She's a full code. She's ambulatory with a walker but must be assisted while she's here. Medical history is brief, and she is not currently taking prescription medications aside from in-hospital orders. Alert and oriented to person, place, and time. She's frail but obese. Blood pressure is 144/90. Heart rate 88. Respiration's 24. Temp is 99.1. O2 sat is 92%. She's showing sinus rhythm on the monitor with occasional premature beats. The wound is a 4x4x1 with serous exudate present without odor. No undermining, tunneling, or bruising. We're doing vitals every 4 hours. She's allowed to stand up with walker, but with assistance. She's on a regular diet, and she'll be NPO after midnight. She has orders for oxycodone every 4 hours, morphine every 2 hours, PRN for pain, and Senesides for constipation. She has antibiotics ordered, which you're about to give. She's had a CBC, comprehensive metabolic panel, INR, PT, PTT, and urinalysis have all resulted showing a decreased albumin level and elevated white count. She has an X-ray and ECG that are pending. A nutritionist and wound specialist are scheduled to see the patient post-op, and our current wound care is just to clean with saline and cover with hydrocolloid dressing. Do you have any questions?
I sure do. Why specifically is the client receiving this medication, and what action does it have on the body?
She's showing signs of an infection. Her white blood cell count is high. Her blood cultures were also positive for E. coli. And the drug itself will inhibit protein synthesis in bacteria at the level of 30S ribosomes.
When should you question administering this medication?
When the client has any hypersensitivity to penicillins or an intolerance to bisulfates, you should also use it with caution in patients with renal impairment, hearing impairment, neuromuscular diseases, pregnancy, and neonates.
Is there a therapeutic serum level?
The therapeutic serum level, the optimal level, is 0.5 to 2 mics per milliliter, and at the peak of 5 to 10 mics per milliliter.
Which vital signs must be monitored?
We'll need to monitor vital signs, blood pressure, heart rate, eyes and nose.
Are those including the physiological parameters?
We'll need to monitor for changes in lung sounds, wheezing, pulmonary edema, as well as peripheral edema, urticaria, angioedema, and difficulty breathing.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital and at home?
We want to discuss with the patient how to recognize signs of anaphylaxis and fluid overload.
What are the side effects and potential adverse reactions?
There's ataxia, vertigo, ototoxicity, nephrotoxicity, muscle paralysis, hypersensitivity reactions.
And how will you know that the medication is effective?
When the client no longer exhibits signs and symptoms of infection.
Okay, thank you.
All right, so we're going to pull the medication. I'm going to check the MAR, check my dosage. We have a rate of potassium chloride, 20 milliequivalents for running at 125 milliliters an hour, and gentamicin, which will be given over 1 hour as 80 milligrams in 100 milliliters. We're going to pull it out. We're going to compare it to the MAR. risks. We're going to compare the numbers to the MAR and make sure we have the right medication. We want to check with the pharmacy to make sure that the potassium chloride is also compatible with the gentamicin, and it is.
Absolutely.
So,
All right, today we're taking care of Marta Yarn. She's right here in room 529. She's an 80-year-old
we're going to check
female
the
with
expiration date.
heritage. She's a full code.
We're going to check
And she's
route,
an
time,
MRI
dose,
allergy.
patient, and
She's
medication.
admitted Tuesday at 1500 for
And we're going to
non-hearing
plan
sick
for
person.
monitoring desired effects, which are
Right now her diet
anaphylaxis.
is a regular general diet, but
And
she's
fluid
gonna be
overload.
at midnight because of surgical debridement.
Boom, boom.
Her current state is stable condition. She has a stage 3 non-healing.
Mrs. Yarn, or Miss, yeah, Mrs. Yarn.
And has been treated as an outpatient with
Can I see your wristband? Are you having any pain today?
The patient
Nope.
has an IV
Can you tell me your
and
name
dorsal metacarpal
and birthday?
and no
I'm
redness or
Marta
swelling
Yarn. I'm
noted
80
at
years
the site.
old.
Patient needs standby
Do you have any
assistance
allergies to
and
medication?
ambulates with a
No.
walker. Right now she's on standard precautions and her last vitals was followed. Her blood pressure is 144/90, respiration is 24, temperature is 99.1, pulse is 88, her oxygen saturation.
We're going to
is
give you some
92%,
antibiotics.
And her pain level when
Okay.
last assessed.
Do you know what
was
these are
6,
for?
and we're gonna assess that again when
Nope.
we go in.
All right, we're going to give it to
She
you
has a
because you
history
have
of
an elevated white count.
dehydration and pneumonia.
Your white
Her
blood
last
cell count
admission
is
was
high,
6
which means
months
it's
ago.
fighting
The patient
infection.
does not smoke and has no history of
Your body is
or
fighting
chronic
infection.
illness. She's widowed, lives alone in a senior housing apartment, has 2 adult children that live at
And
a
your blood
site
cultures
around
came back
Fisher
positive for E. coli. So after we give this, we want to make sure that you watch for signs and symptoms and notify us if you have any shortness of breath, if you notice any blotching on your skin.
Her reflexes are +1 symmetric bilaterally.
Maybe we say
She has
shortness of
chest
breath.
expansions that are symmetrical, clear to auscultation in all fields.
Tell me what you would do under
Anterior
those
and
circumstances.
posterior are diminished.
Push
in
my
the
call
bases.
button.
She's
for you to
sighted,
come
hard
in.
of hearing, no
Sounds
change
good.
in vision. She's a 20/40 vision bilaterally.
I
Mucosa
need to
is
flush
clear
your
with
IP
no
really quick.
lesions.
We want to check that.
Denies any chest pain, palpitations, or shortness of breath, or sinus rhythm with occasional premature beats. Patient complains of lower back pain, aching quality for the past 3 months. Gait is coordinated but slow. The client verbalizes decrease in appetite, no
Feel any
complaints of
burning?
nausea, vomiting, or change in stool pattern, consistency,
Taste or
of
smell
color.
metal?
Patient complains
No.
of occasional
Yes.
stress intolerance and bacteria. Abdomen is soft, non-distended, non-tender, slightly obese. No masses. Bowel sounds are present in all 4 quadrants. Stool is brown, guaiac with negative, and no rectal masses. She is currently frail, thinning skin is intact except for a sacral wound at stage 3, 4 centimeters by
So
4
you're not having any
centimeters by
pain?
1 centimeter.
No,
Okay, you're
Involvement
due
of
for
the
morphine,
surrounding
but
tissue
we're
is kidney
going to,
shaped.
I don't
She has
want it.
serious exudate
Okay, good.
without unusual odor. No undermining, tunneling, or bruising was noted, and she has poor skin trigger. Her last labs were as followed. Urine's clear, amber in color. Patient has protein in the urine, which is 11.6 grams. She is negative for leukocyte esterase, nitrates, ketones, and glucose. Her phosphate is 3. Her PT is 11.8. The INR is 1. Blood culture and sensitivity came back positive for E. coli, and that's why we're going to be administering the gentamicin today. Her PTT is 62 seconds, and albumin is 3.2, which is
Can I see your
low, so
wristband,
we need
please?
to educate on increasing her protein intake. Her B1 is 22, which is high. Creatinine is 1.1, ALP is 118, potassium is 3.6, sodium is 145. Her hemoglobin is 12.1, hematocrit is 37, and her white blood cell count is 12,500, and the differential lymphocyte is 4,500, which is high, as well as her monocytes, which is 720. Her platelet is 155,000, and that's about it on the labs. So the current medications that this patient is on is the gentamicin. It's an IV piggyback every 8 hours. She's also going to be receiving 1,000 milliliters of 0.9% sodium chloride with 20 milliequivalent for KCl. And that's going to be administered at 125 milliliters per hour. Let's see. She's also receiving acetaminophen, oxycodone, 2 tabs every 4 hours for pain as needed. Morphine sulfate injection, 2 milligrams of IV every 2 hours for pain. Senosides 8.6 milligrams, 1 to 2 tabs every morning, PRN. And Zolpidem 5 milligrams by mouth every night as needed for sleep. Some of the things I recommend for this patient are to take the vital signs every 4 hours.
Are you priming the
Her
tubing?
activity is up and up with walker and standby assist. She's on a regular diet. NPU after midnight because she's got surgical debridement in the morning. Continue to assess IV site of warmth and swelling. Continue to administer oxycodone and acetaminophen for the pain every 4 hours as needed. Also administer the 2 milligrams of morphine sulfate via IV every 2 hours as needed for pain. We're going to need to complete a CBC with differential, comprehensive metabolic panel, INR, PT, PPT, and urinalysis as well. We're also going to need to complete a chest x-ray, electrocardiogram. We're also going to need to have an internist and wound specialist to follow the patient post-operatively. We're going to need to clean the sacral ulcer with saline and cover with a hydrocolloid dressing. And as I said earlier, we're going to need to educate the patient on her diet, particularly to increase protein intake. Do you have any questions for me?
Yeah. Why specifically is this client receiving this medication?
Right, so this client is receiving this medication because she has an E. coli infection.
And what action does the medication have on the body?
This medication is a bactericidal action, and what happens is it inhibits
Channel
protein
select,
synthesis in the
guardrail
bacteria
IV
at
fluids.
the 30S ribosome level.
Do
Alright.
0.9 normal
And when should be a
saline
question administering the
plus
medication?
KCl 20
So
milliequivalents
it's a
per
question of
liter.
administering this medication if one of the 5 rights are not available, such as the right route, dose, time, patient, medication, and documentation. Also, if the client has a hypersensitivity to gentamicin or other aminoglycosides. We're also going to want to question it if the patient is taking diuretics.
125 milliliters an hour.
And if the patient has renal
Yeah,
insufficiency,
1,000
we would also
milliliters.
question it because if she has that and receiving penicillin and cephalosporins, this could inactivate the gentamicin.
Okay. And does the medication have a therapeutic serum level?
Yes, it does. Optimal peak levels are between 4 and 6 micrograms per milliliter.
Which vital signs must be monitored?
You're going to want to monitor the usual
Clean
vital signs
neck
such as
tubing.
pain, temperature, heart rate, blood pressure. But for this client especially, we're going to
Hit
want to
start.
monitor the respirations. She is taking 2 different kind of opioids, and these have a tendency to decrease the respiration rate. We're also going to want to monitor for superinfection. Some of the signs for this are going to be fever, upper respiratory tract infection, vaginal itching, increased malaise, and diarrhea.
And what else, which physiological parameters besides that should be monitored?
Alright, so we're going to want to monitor the renal function, and we're going to do this by urinalysis, specific gravity, BUN, creatinine. We're also going to want to monitor the AST and ALT for this patient.
And what intervention must be done to the client to ensure the medication is being taken safely in the hospital and at home?
We're going to want to make sure that the 5 rights are apparent. And in the hospital, we're also going to want to make sure, especially that it's the right patient and
Connect
we're also going to check the
gentamicin.
medication for the expiration date.
IV
And we're going to
piggyback.
want to keep these clean procedure, and what I mean by that is washing hands before and after administration. And we're going to want to wipe down the ports and injection site with alcohol wipes. It is important to also place the initial date and time on the tube after it is hung through an IV. And we're going to want to check for IV patency by flushing with 5 to 10 milliliters of normal saline.
Okay. And what are the side effects and potential adverse reactions?
Some of the side effects or potential adverse reactions are ataxia, autotoxicity, vertigo, nephrotoxicity, muscle weakness or paralysis, and hypersensitivity reactions.
Okay. And how will you know the medication is effective?
We're going to know that it's effective if it resolves the signs and symptoms for the infection that she has, or if the blood culture comes back negative for the E. coli.
All right. Thank you so much. That's all
Alright.
questions I have for now.
Hi, how you doing? My name is Erica, and I'm going to be your nurse today. And with me, I have a nursing student. Her name is Harissa. Do you mind if she watches this?
No, it's okay.
All right, cool. So today you're going to be
Set my
receiving your
secondary line,
gentamicin.
channel
All right.
select.
Before we get started though, are you in
Secondary.
any pain?
No,
No pain?
no,
Do you have any allergies that I should be aware of?
no.
All right. So have you ever taken this gentamicin before? No?
Gentamicin,
Well, some of the adverse reactions you're going to have to look out
8 to
for
12
are
hours,
ototoxicity,
80
which is
milligrams and
basically
100 milliliters.
problems with hearing. You're also going to want to watch out for ataxia, which is problems with coordination and balance. And if you have any of these symptoms, you should definitely call the healthcare provider. All right. I also wanted to tell you about the diet that you're on. Do you intake a lot of protein? No?
No.
Okay, well, in your blood test
You have your
results,
call button?
your
Yeah.
albumin was really low, and your albumin measures how much protein is in your body. So you're gonna need to increase your protein intake in your diet. By doing that, it's also gonna help with the healing of the sacral wound that you have as well. All right? Let me check here. What's your name and date of birth?
My name is Martha Young, and I'm 80 years old.
Okay. And did you wanna receive this gentamicin today?
Sure.
Okay.
Do you have any questions?
about
Alright,
your
so you're
breathing,
gonna be
your procedure.
giving
No, they already came in.
1,000 milliliters of sodium chloride, all right, and gentamicin as well. So I'm gonna need to check for patency of your IV. Before I do that, I'm gonna.
I have a few questions for you.
All right, go ahead.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
We had to review allergies, of course, drug compatibility between the potassium chloride and the gentamicin, and also the 5 rights of administration.
Did this information affect your decision to administer the medication?
Yes, I wouldn't be able to administer the medication if the client was allergic. The drug was not compatible with the fluids, or the 5 rights were incorrect.
Did this information affect how you administered the medication?
Give it a little squeeze to make sure that there's no hold in it as well.
Not at this time, no.
Okay, that's all that I have. Thank you.
All right,
Thank
we're gonna
you.
wanna check the line.